This is the Emergency Medical Minute, sponsored by Health One.
All right, everybody come gather around. We're going to look at an EKG. So this is the case. 50-something-year-old guy comes in with a syncopal episode, looks pale, sweaty. What are your first thoughts?
Cardiac.
Yeah, it's VTAC. So before you even get the EKG, you think airway breathing, circulation. So is he breathing? He was kind of labored breathing. He looked pale, diaphoretic. He had good pulses at first. Trying to get him on the monitor. The blood pressure cuff keeps on going off, cycling as we're trying to get an IV. He starts to say, I really don't feel good. What's your next step? Shock, yeah. So I think this is a really valuable thing. We don't have to wait for IV blood pressure to shock these people. I've actually had 2 cases of unstable VTAC in the past 6 weeks, and one we shocked before we even had an IV or any sedation, and he came out of it and he said, wow, I feel great, thank you. And then this guy, we were getting IVs, and then I was feeling his pulse as the blood pressure cuff kept going and going, and it got weaker and weaker, and I said, just shock him as they were pushing the etominate. And then he goes, after he gets shocked, he comes out of it and he goes, wow, I feel so much better. And then he falls asleep. The etominate kicked in after. I'm hoping he won't remember that. But just a reminder, anything that's unstable, whether it's wide complex or narrow complex, you need to shock them out of it because they are going to code on you. It's much better to shock someone before a code than during a code because your chance of success is much better if you get them out of it quicker, obviously. Also, there's a theory that the more shocks you have, the less chance of getting them back. Your biggest chance of success is your first shock. So who's heard the phrase go big or go home? You don't always have to start at the minimum. If it's a big person, if it's like a rapid AFib, those can be hard to cardiovert. You don't have to start at the minimum. You can go higher. We did 150 synced on this guy. Make sure it's synced. After the first shock, it will go back to unsynced. So you have to go back and look at the monitor, make sure it's synced. Otherwise, you can cause a VFib. So, all right. Thanks, guys.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.